I'm Dr. Natasha Guest, founder of Guest Compliance Consultant LLC, and I help small healthcare teams become audit ready, stay compliant without all of the overwhelm. I ensure that you protect your revenue and you're always compliant. Stay with me on this first episode of the Compliance Corner Live. You don't want to miss the update that I have here. It's on the 2026 PFS final rule. It's going to impact small practices the most, and some of you don't even know where to get started or how you're going to be impacted. If you're catching the replay, leave a comment below. Just type replay so I know that you tuned in. So this week, my compliance tip was on the 2026 Medicare physician fee schedule. And it's a doozy. It is a lot. So if you see me look at my notes, just know that I'm trying to ensure that I show you guys everything, I explain everything, I simplify everything. So I know compliance can be intimidating, it can be overwhelming. All of the updates, the acronyms, and policy changes, they tend to blend together. But like I say, compliance doesn't have to be complicated. Okay? I can simplify that for you. And it also is about what you think is most important for your practice. Once you know that, you can now break that down into simple rules and get it done in a realistic way. So, just a little story for you. Last week, I spoke with a small clinic that didn't understand how the 2026 updates would affect their telehealth systems. But guess what? That's what I'm here for. Ensure that it's simple. Ensure that you walk away feeling confident after hearing this. So, if you feel like this sounds technical, it's not. I'm going to break it down. I'm going to ensure that you understand. And I'm going to give you actionable steps so you can start in your practice. So, you're probably asking yourself, well, why does this all matter to me? I can tell you that. Every year, CMS releases updates that determine how they pay you for your service. But this year's final rule for 2026 includes some major changes for small healthcare teams the most. There's updates to reimbursement rates, updates to telehealth supervision, there are updates to behavioral health codes, and how CMS will pay you for your practice expense. So if you're a private practice or a small healthcare team, this is not just about your billing. It's about keeping up with your documentation, your workflows, and ensuring that your compliance policies are audit ready for the next year. Now, for the key changes, the first one I'd like to talk about has to do with the two different conversion factors. And you're like, well, what do you mean? CMS has decided that come January 2026, they will be paying via two conversion factors. One for QPs, which are those qualifying APM participants, those providers in the value-based services program, and that's like ACOs or advanced APMs. Then there's the non-QPs, all of the other providers that are paid fee for service. So what CMS has done for QPs, they've decided that they're going to pay them a slightly higher rate and bonuses, and their conversion factor was finalized at $33.57, which is a 3.77% higher than this year 2025. Non-QPs are being paid at $33.40, which is a 3.26% increase from this year as well. So, what you'd want to do is check your classification and update your financial projections. Another big one has to do with telehealth supervision rules. You know, all of those flexibilities that happened during COVID 19? CMS has decided that it's time to make those permanent. So, for your supervising physicians, they can now provide direct supervision via real time audio and video telecommunications. This will apply to stuff like your diagnostic testing, your incident to services, and the rehabilitative services. So, as a small healthcare team, you're going to want to document whether your supervision is done virtually or in person. And while doing that, ensure that you include the time, you include the platform, and who the participants were. Additionally, you'll want to ensure that your policies reflect supervision updates and the supervision method. When CMS does an audit, they want evidence of compliance. So ensure that you keep that. Another update that I think is an absolute win is for behavioral health. CMS added additional behavioral health add on codes for 2026 so that you and your team can support collaborative and integrated care. This allows for you to bill for coordination and care management tasks that is outside direct patient contact. So, my tip for you is add these codes to your EHR and ensure documentation supports all bill time. Then you can audit a few recent charts just to see if you have any missed opportunities. There is one more update for behavioral health that I think is really great. CMS has also decided to expand payment policies for digital mental health treatment. And it will be those services that include devices used for treating ADHD. I think that's a big win. Now, the final one for small healthcare team is your practice expenses. CMS decided that it was time to recalculate how practice expense RVUs are determined. They have finally recognized that there is greater indirect cost for office-based providers. So this will impact your reimbursements for rent, for your technology, also for your supplies. So ensure that your setup codes accurately reflect that you are a non-facility site, and also ensure that you review your cost reports and align internal budgets with these CMS updates. Now, that was a lot. I know. I'm going to pause for a second to take a sip of water. Okay, much better. So, I have one final bonus tip for small healthcare teams. If your team participates in the Merit Based Incentive Payment System, MIPS, or a Shared Savings ACO, then you need to review the 2026 updates to quality scoring. CMS decided that, hey, we're going to remove the health equity adjustment for ACOs so small practices can actually focus on core quality and reporting accuracy. Alrighty. Now, if I were in your practice, this is what I would do now. I would ensure that I review my QP status. I would update telehealth supervision policies, add those behavioral health codes to your billing, and then review your practice expense budgets. If you start now, all of these small, consistent steps will make 2026 so much easier for your practice. Now, I have a question for you guys. Which one of these updates will matter to your practice the most? Telehealth, documentation and coding, behavioral health, or practice expenses? Drop a comment and I'll get back to you. If you have questions, I will respond to you right away. Now, before I wrap up this call, or this live, I must say, I can get you a 2026 Medicare physician fee summary if you like. I will drop the link in this post. You can find that at my website, guestcomplianceconsultingllc.com. And you can also sign up for weekly emails with updates about CMS, HIPAA, any of the regulations. I'll drop that link in the post as well. Also, why don't you join the conversation at my Facebook group, the Compliance Confidence Circle? That link will be there as well. Now, thank you so much for joining me this evening. I hope this has been helpful. Next week, we're going to be diving into the wonderful world of HIPAA. And I love HIPAA. I love speaking about HIPAA. And I love breaking down HIPAA so that you can understand it. Until then, keep things simple, stay confident, and please remember, compliance doesn't have to be complicated. Have a wonderful night.